A Valley couple facing a $42,000 medical bill. $42,000. Breathing a sigh of relief tonight after 12 News started asking questions.
12 News journalist Colleen Sikora reports how a small code landed them with an enormous bill.
When it comes to miracles in Donna Lewis's life,
If I didn't have it, I would not be here today.
a liver transplant through Mayo Clinic in 2019
It was an absolute miracle.
counts as 2.
After she had the transplant, they came back with the pathology report from the diseased liver, and they found cancer. They had found that just like 2 weeks before she would have ever gotten the transplant.
In March of 2022, when a hernia developed where the transplant scars come together.
It was something that we kind of had expected.
But what came after the hernia surgery?
I was shocked.
Unexpected.
I couldn't even imagine trying to pay the $4,000 a month payment to them until you got done paying the $42,000. That's like a car, that I'm not going to drive.
Donna's husband, Robert, finding out about it in August 2023, 17 months after the surgery. Then the $42,000 bill showing up on their October statement.
United Healthcare told us that it was because Mayo had billed it as weight loss surgery.
Months and calls with differing stories later.
Now we'd like you to start paying. And I was like, this can't be.
So Robert contacted 12 News, and we started asking 1 week ago, contacting both Mayo Clinic and United Healthcare to find out what was going on with the Lewis's bill. Robert continuing to ask too, finding it was now a diagnosis code.
This particular code is for anorexia. And it's like she's never had anorexia. She's never been treated for, sought treatment for, been diagnosed for.
Asking Mayo Clinic's billing to go back to the doctors about R630.
And they're like, yeah, we don't bother our doctors. Their job is to treat patients. And I get that. But when you're willing to strap us with a $42,000 bill and you're willing to let us pay it, that's a problem for me.
Even the nurse for Donna's surgeon saying there was nothing about anorexia in her file.
Anybody that's dealt with medical billing probably already knows it's a broken process. It just doesn't work very well, and these things happen.
Mayo Clinic telling us earlier this week the bill was under review. United Healthcare telling us they've been working with Mayo on the claim and are reprocessing it under her benefit plan. A spokesperson saying, quote, "We are sorry for any confusion this may have caused as we look to ensure that her hospital claims were paid appropriately." This morning. How do you feel?
Weight lifted off.
Robert hearing from the insurance company the bill was paid.
Literally in the last week or so is when all the movements came. When they did tell me that they were able to get it rebilled, United Healthcare wasn't even really able to tell me what it was that they changed on the bill.
No longer on the hook for a $42,000 medical bill.
No is never the end all be all answer. There's always another way to go at it, which is how I landed here on this phone call right now.
Colleen Sikora, 12 News.
I'm glad they called Colleen. All right.